Welcome to this video. Today, we'll talk about the cost to build a fertility and reproductive health app in 2026. So, let's begin. If you want to know the actual cost, there's no one straightforward number. It could cost you $40,000, or it could cost $250,000. And if you're building a full-scale reproductive health platform with AI, wearable integrations, telehealth, clinical dashboards, and healthcare-grade compliance, the budget can go well beyond $500,000. So what creates such a massive difference? It's not just the number of screens, it's the healthcare complexity behind the app. And in this video, I'll break down exactly what drives the cost, what features you need, how much each development stage can cost, and where founders often underestimate their budget. Why are fertility apps becoming a bigger opportunity? Let's start with the market. According to Grandview Research, the global fertility and ovulation management segment of the menstrual health apps market was valued at about $738.3 million in 2025 and is projected to reach approximately $3.5 billion by 2033. And the underlying healthcare need is significant. The World Health Organization estimates that around 1 in 6 people globally experience infertility during their lifetime. That creates a large opportunity for digital products that can help people track reproductive health, understand reproductive patterns, connect with clinicians, and manage treatment journeys. But there is an important distinction. A simple period tracker is not the same product as a fertility management platform, and that's where development costs start increasing. So, how much does it cost? For a rough 2026 estimate, a basic fertility tracking app can cost around $40,000 to $70,000. A mid-level fertility and reproductive health app can cost around $70,000 to $150,000. And an advanced platform with AI, telehealth, wearable integrations, clinical systems, and advanced analytics can range from $150,000 to $300,000 plus. For enterprise-grade healthcare platforms, the budget can go beyond $500,000, depending on integrations, regulatory requirements, infrastructure, and the number of user roles. These are development estimates, not fixed market prices. Your actual cost depends on the product scope, team location, technology stack, integrations, compliance requirements, and whether you're building an MVP or a production-ready healthcare platform. What exactly are you building? Before estimating the budget, you need to define your product. A fertility and reproductive health app could include period and cycle tracking, ovulation prediction, fertile window estimation, basal body temperature tracking, cervical mucus and symptom logging, medication and supplement reminders, pregnancy tracking, trying to conceive workflows, fertility education, partner accounts, doctor consultations, appointment scheduling, lab result management, and potentially AI-powered insights. You could even connect the platform to wearables and health platforms to automatically collect heart rate, temperature, sleep, and activity data. For example, Apple's health ecosystem already supports reproductive health-related data, such as cycle tracking, heart rate, and wrist temperature, showing the type of data ecosystem modern fertility apps can potentially integrate with. Every additional data source creates additional development, testing, security, and integration work. A fertility and reproductive health app should include features like user onboarding and profiles, cycle and fertility tracking, AI-powered fertility insights, wearable and health platform integrations, telehealth and fertility clinics, security and compliance. Here's a realistic cost breakdown. For a basic fertility tracking MVP, you might have UI/UX design, $5,000 to $10,000. Mobile app development, $15,000 to $25,000. Backend and database, $10,000 to $15,000. Admin dashboard, $5,000 to $10,000. Testing and deployment, $5,000 to $10,000. That brings the MVP into the range of roughly $40,000 to $70,000. For a mid-level platform, you're looking at advanced features. That can put the project around